Phenibut. What's the seduction of this drug? What's the legality of it? What's the dangers? So my experience with this goes back a long time, probably 17 years. This is not a new compound. This was formulated 1963 in St. Petersburg, Russia. In 1975, the Russians used Phenibut on the Soyuz space missions to decrease anxiety for the astronauts. It's sold in the United States. You could buy it at Nootropic Depot, Happy Hippo, Lift Mode. You can order this online anywhere you want. Okay, so what's the seduction? Well, if you take 250 milligrams, 500 milligrams, what could happen is a little euphoria, you have a great night's sleep. You increase the dose, you could get euphoria. You could get decreased social inhibitions. You could interact with people of the opposite sex easier. Social anxiety goes down, confidence goes up. There's more pleasure in listening to music. There's more pleasure in sex. Your libido goes up. You have a sense of well-being. There is almost a high. There's more, it's activating, energizing, and can help with cognition, memory, learning, may help with pain syndromes. It's used in the Eastern Bloc countries, Ukraine, Latvia, Hungary, Russia. What are some of the uses for it? Legally, for attention deficit disorder, social anxiety, panic disorder, generalized anxiety disorder. It is believed to help with sleep, fatigue. It could help with pain syndromes. It's also been used for people with strokes or people who are having a heart attack. Anything that decreases blood supply to the brain, this is considered neuroprotective. It also may have some benefits by increasing growth hormone. Weightlifters use it. Let me think if I could think of any other uses. Those are about the uses. Also with the seduction, normal doses are 250 to 500 milligrams at a dose. But at higher doses, 1,000 milligrams to 2,000 milligrams, you have extreme, I would say, euphoria, excitement. You want to be around people. You're extremely social, maybe hyper-focused, attentive, confident, sort of like an alcohol amphetamine type change in your mental state. 2,000 to, let's say 2,000 to 3,000, you start getting possibly sedated, possibly loss of motor control, but still confident, high, enjoying music, sex. Maybe the learning tapers off. After 3,000 milligrams in a dose, you start experiencing sedation, motor discoordination, dizziness, drowsiness, blackout, seizure, aspiration pneumonia, loss in vision, hallucinations. So how are you going to explain this? I talked about some of the good with this compound. Let's just talk about a little bit of what it's doing. This drug affects GABA-B. GABA is the inhibitory neurotransmitter in the body. So it affects, there's a GABA-A and a GABA-B. I did a video on benzodiazepines. I'll put it at the end of this, at the end plate, so you can see that video and learn more about benzodiazepines. But benzodiazepines hit the GABA-A receptor, causing sedation, decreased anxiety, calming effect. The GABA-B is mostly used for muscle tension, muscle spasms, A drug that affects that primarily is called baclofen, and it's used as a muscle relaxant. So when we stimulate the GABA B receptor, we calm muscles down, calm neuromuscular electrical transmission down, so the body comes down, spasms stop. So this mostly affects GABA B. Okay, so you think all it should do is affect muscle spasms, right? But at higher doses, it goes beyond GABA B and hits GABA A, causing sedation, drowsiness, and everything that Klonopin, Ativan, Xanax, Librium, Valium, Restoril, all those drugs, all the side effects of those drugs, you get those drugs. Side effects. There's more to it. It doesn't just affect the GABA B receptor and at higher doses GABA A, it affects voltage-gated calcium channels. Now, you know what else does that? Neurontin, gabapentin, and pregabalin, Lyrica. So we know what those drugs do. Those drugs are for neuropathic pain. They may cause a euphoria. They may cause a decrease in social anxiety, a calming effect. I think most of the action of Phenibut is from this voltage-gated calcium channels like Neurontin and Lyrica, which is pregabalin. But we're affecting both the GABA B and at higher doses GABA A and the voltage-gated calcium channels. So we're getting both the benefits and the downside of, let's say, Xanax, Ativan, and Klonopin, and Neurontin, and Lyrica. Okay, that sounds great. So at low doses, you're getting a little bit of muscle relaxation. You're getting all the effects of, let's say, a Neurontin, calming, euphoria, decreased social inhibition. And this combination is great at the lower doses. That's fine. The problem is, this drug, when given, its pharmacokinetics, I would call it a trip. Once you take it, you're on a ride for the whole day. Yeah, it kicks in 45 minutes, peak plasma level, 2 hours, 3 hours, but there's something more going on here with this drug. Since we're having the dual mechanism of action, both the Neurontin type effect and the benzodiazepine type effect, something weird happens with this drug where all day you are feeling initially up, high, energized, focused, learning, enjoying sex, listening to music, enjoying it more, more observant, more wanting to be around people, more talkative, less inhibitions. But then you get into that disorganized, delirium, sedation, dizziness, fatigue, muscle coordination, seizures, passing out. The drug lasts, its half-life is about 5 hours, but it seems to have an unusual effect where it lasts for 24 hours and up to 3 days. And if you keep taking it, called stacking, for 3 days, you just get confused and out of it, and the withdrawal is god-awful horrible. It's the worst I've seen. And this is how I come into contact with this Phenibut, with withdrawal. And people who, tease the lion, one dose maybe is fine, but if you dose this daily for 3 days, you will get into trouble. You will have a serious problem because you'll get confused, you'll get delirious, you'll have alternate states of reality, and you'll be like, psychosis. And I say psychosis, you'll be misreading what's going on around you and making false assessments of what's happening around you. And you'll be in a state of confusion. And I have seen this effect. I have seen the tremors, the tics, the dizziness, the slurred speech, the disorganized behavior after using it. And someone says, well, I didn't have an effect after 4 hours, so I took more. Well, you are going to get in trouble. There's something magic about this. If you take more than 3,000 milligrams, you're in trouble. You use this for 3 days, your withdrawal is going to be god Awful, horrible. That's the pharmacokinetics. Your kidneys basically excreted unchanged. It's pretty safe on the body, on the organs, but the withdrawal is severe anxiety, overdose, seizures, dizziness, delirium, death. It's nasty stuff, and it's legal. I'll get into that part. Is it legal? Yeah, you can buy it. It's legal. So I'm very leery of this drug. It's trouble because it creeps up on people, and they wind up taking more. And I've had people go over that 3,000 mark. It's trouble. They wind up in serious trouble. Their mother usually is calling, or girlfriend is calling 911. They're not making any sense, and they're talking gibberish, and it doesn't go away. Or they're just passed out on the ground. And I get people who play with it. Oh, I get this one girl comes to my office and says, I take it because I don't want to get a DUI. So I take it, and I don't drink when I go to concerts. I'm like, great. And then she gets all out of it. I got weightlifters who use it because it increases growth hormone. It gets them a little high and buzz and stops their social inhibitions. And they can go out and have a good time, and they're all feeling great, but they don't want to get the effects of the alcohol. But all these people, they get a taste of it and they use more. It's extremely addictive, and they go into this withdrawal syndrome. And everyone winds up taking more than they're supposed to. No one just takes 250 milligrams or 500. Everyone gets to the 1,000, 1,500, 3,000. Everybody gets in trouble with this stuff. I've had very few people maintain it because it's seductive, because you feel great at small doses. No one seems to be able to keep it at that dose. The bad, if you mix this with other benzodiazepines, if you mix Phenibut with baclofen, Klonopin, Valium, Xanax, Restoril, Ativan, you'll get a synergistic effect. Or alcohol, you will become sedated and you could pass out. If you continue on this beyond one dose and use it for days on end, use it 2 days or 3 days in a row, you will get confused, lose track of time, lose track of reality, and not know what's going on. And you will get in trouble. I've had some patients say, well, I only use it 2 times a week, and I only dose it twice a week. And they say, I don't get in trouble. I don't know about that. This is what I'm told. It comes as a salt. It's a powder. I hear it tastes like a metal orange. So I don't know what that means. I'm very leery of this drug being available just to buy, to take at any dose you want. I'm an Agresti no on this. I would avoid it. I think it's trouble because you're going to get the worst withdrawal. You're going to get both a benzodiazepine and a gabapentin Lyrica withdrawal from it, which is nasty. I've withdrawn people from it, and it's been nasty. They're miserable for weeks on end, and the rebound anxiety when they stop it is horrible. They're not happy. They're miserable. I have had some people say this is the worst withdrawal I've ever been through. And I'm talking people who've come off high-dose methadone, high-dose buprenorphine, high-dose Xanax, and they're telling me high-dose Phenibut is the worst withdrawal they've ever been through. Don't take that lightly. Don't get involved with this drug. Don't repeat dose it. It's extremely miserable. And remember, don't take it with anything else, like alcohol or any other benzodiazepine or any muscle relaxant. It's extremely dangerous. Yeah, passing out at concerts, passing out on planes, passing out in your bedroom. I've had mothers drive their son. He's talking gibberish, making no sense. And I'm like, what are you taking? And I'm thinking, in my mind, I already run Phenibut, GHB through my mind. Because when people are acting really strange, those two things come to mind for me. And I've seen it, or I also think dextromethorphan. I've seen people take that too much. They act bizarre. Those three, they act really bizarre. There's other states I've seen it where people are withdrawing from Xanax or coming off methadone or stop Neurontin or Lyrica cold turkey. I've seen them act that way. it's all in the differential, but that's my little spiel on Phenibut. It's a big Agresti. Don't do it on that. Okay, thank you.